Now, how we do the operation. And traditionally, we perform the surgery with an open operation. Now we perform this laparoscopically or keyhole method. The standard laparoscopic gallbladder surgery is done with 4 ports in the abdomen. Very rarely one may need to place in an extra port. And port is like a very small biro pen-like hollow tube that is inserted through the muscles into the tummy, and then one can pass in the instruments or the camera through this and have a look. So the first port is about a centimeter, 1 centimeter port, which is placed near the belly button, just above or below it or through it, and that is for the camera to go in and have a look. Once this port is placed, we push in some gas into the tummy. This is carbon dioxide that we use. And there are many reasons, scientific reasons for that. But one of the most important, or 2 of the most important reasons are that this is non-combustible. So if we were using any instruments in there with electrodiathermy, so that we don't get any sparks or any other issues like that. The second reason is that it's much more readily absorbable than other gases. So it's 30 times more readily absorbable than air, and so it's very helpful. It gets out of the system very quickly. Sometimes our patients come back a week or 2 after surgery and they say the tummy is a bit bloated and this must be the gas that we replaced. And I do reassure them that it can't be the gas, because the gas gets out of the system very quickly, and we do take it out at the end of the surgery as well. So this doesn't stay in there. This is free gas in the tummy. However, whenever we have an operation, we are taking painkillers, our diet is changed as well, and we may not be opening our bowels as regularly as we were doing before. So some of the residual constipation or a bit of extra gas in the tummy can give us a bit of a feeling of bloating, which is normal, it's expected, but it does settle down. So in any case, once we place gas in the abdomen, then the tummy becomes like a dome and we are able to look around and look at the organs. Then we place our 3 other instruments. The first one is a 10 millimeter port, which is right up in the tummy, more or less in the midline, and then the 2 other half centimeter ports are placed to the side, on the right side of the abdomen. So with these instruments, we lift the gallbladder up, have a look at it. We use instruments in our right and left hand, and we do all the dissection, remove the gallbladder, and then we retrieve the gallbladder in a bag through one of these 10 millimeter ports, and that's the standard operation. Sometimes the stones are large, so we can crush the stones and we can do various maneuvers to keep the cut small. At times we may need to extend this slightly to remove it. And then we close the abdomen and we use some special stitches in the skin, which are dissolvable stitches, so they don't need to be removed. They will dissolve on their own. We infiltrate some local anesthetic into the wounds as well, so that when a patient wakes up, they do not experience any pain in their cuts. And there are about 8 or 9 other factors that we try to maintain during surgery so that the operation is less painful for the patients. With traditional open surgery, despite injecting the local anesthetic and taking all the precautions, patients, when they used to wake up from the anesthetic, they used to experience pain of about 6 to 7 out of 10 after open gallbladder surgery. After laparoscopic cholecystectomy, they are likely to experience pain about 2 to 3 out of 10. For the last 18 years or so, this has been my issue with laparoscopic surgery in general, and especially with laparoscopic cholecystectomy. And I strongly believe that a procedure which we have been performing for the last 30-35 years, we should improve on that procedure. And there are quite a few things that I've done to improve this, and we try to get the pain down to 1 or less than 1 or 0. And I have performed gallbladder operations where patients may not have any pain whatsoever afterwards. And there are several things that one has to take into consideration to achieve that while performing the operation. This is the pressure of the gas, the flow, the temperature, and various other things that one has to do, and how you handle the tissue as well. So we do try to achieve it. The other things that we would try to achieve for gallbladder surgery is to further minimize the size of the cuts. So though 1 centimeter is just like the tip of my little finger, but we reduce this to 0.5 centimeter. So most of my operations that I do not use 10 millimeter or 1 centimeter reports. I use half a centimeter reports for that. And this way we can get a great result for the patient, less postoperative pain. Cosmetically it's much better as well. If the size of the cuts is small, then one does not need to avoid exercise for several weeks after, or 3 to 6 weeks after surgery. One can resume the exercise sooner rather than later and return to driving, return to work, and all these parameters are much better with this approach.